Hello everyone. Am I audible and visible? Let me know. Let me check. Am I audible? Let let it started. Hello everyone. Welcome to Unacademy Future Doctors. Here in this channel, we are posting videos for MBBS university exam going students. And these videos are very helpful for all the MBBS university exam going students. So if you have anyone in your friend, family, or your junior who is appearing for MBBS university exams, you can share all those videos with them. I myself, Dr.Dipti Kariya, I am MD PhD Physiology Associate Professor and I am educating MBBS nursing and physiotherapy students. I have more than 17 years of teaching experience. Now, let me explain something about our subscription first. We have two kinds of subscription. One that is plus subscription. Here you can choose the best from the best. Here you can access both live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank with more than 25,000 questions. You can compete in live tests and quizzes. And within 12 months, they are coming with a printed notes. Next variety of subscription, that is iconic subscription. Here your access to the best from two of the best. Okay? Which are these two? One that is Unacademy and Prep Ladder with Unacademy. All the features I have already discussed. Second one that is Unacademy and Prep Ladder with Prep Ladder. Here, features of the second one, that is you can have clinical and integrated essentials. You can have video lectures from the Dream Team. You can have question bank 3 with active guidance, system tags, and much more. Rapid revision and snapshots, pressures in 2021 dream notes. So you can subscribe from your mobile, either plus or iconic subscription. You can use my code DIPTI10 to get extra 10% discount on any of the subscription. Longer the duration of subscription, cheaper are the rates. So if you are first or second MBBS student, I prefer you have longer subscription. Okay? Now, let us start with our topic. Today's topic is abnormality of immune system. In last previous lecture, we have discussed some of the abnormalities of immune system. One of them, that is immunological or tolerance, which is reduced, and that results in autoimmunity. So here we will discuss now with other abnormalities. One important terminology, first of all, we will discuss, that is immunological surveillance. The name itself suggests that there is survey. So, what is this survey and when this is required? Here, whenever our normal body cell it transfers or it is transformed in the cancer cells. Daily, so many cancer cells are also produced in our body, and these cancer cells or tumor cells, they are recognized by our immune system. Okay? And these are recognized as non-self. They are not our body cells. Okay? And they are destroyed. Okay? And this response, which is produced for the destruction of this cancer cells, that is immunological surveillance. This immunological surveillance that is carried out by our cytotoxic T cells, macrophages, and natural killer cells. Okay? So mainly these all cells are involved in cell mediated immunity. So Mainly there is role of cell mediated immunity in this immunological surveillance. Okay, and now here with increase in the age, you can see here as age increases, you can see cancer risk increases. You can see risk of breast cancer, colon cancer, all increases with increase in age. What is the reason for this is because with advancing age, this cellular immunity mechanisms they decline, and because of decrease in cellular immunity, there is increased chances of tumor. Okay, now next abnormality related with immunity, that is immune deficiency. Okay, what is immune deficiency? There is either lack of some component, either one of the component is lacking or defect in some component of our immune system. And because of either lack of component or defect in component, there is absence of cellular or humoral immunity, and therefore the individual is susceptible to infection, so increased chances of infection. Okay? Examples are, one is DiGeorge syndrome. Here what happens in DiGeorge syndrome, there is congenital absence of thymus, or sometimes if thymus is present, then there is hypoplasia. Okay? Hypoplasia means, I think all of you are knowing aplasia. Aplasia means absence, hypo means reduced function. So what happens here, because thymus is important for proliferation of T lymphocytes. So here cellular immunity is absent. Some infections can be prevented by humoral immunity, but cellular immunity that is absent. Okay? Next immune deficiency disease, that is sorry, agamma-globulinemia or hypogammaglobulinemia. The name itself suggests, you can see gamma globulins, they are this gamma globulins, they are our immunoglobulins. So when immunoglobulins are, A means absent or hypo means reduced. So what happens, because of decrease, you can see here in this diagram also, there is no B cells because of A or hypogammaglobulinemia. Here in newborn baby, up to 3 to 4 months, no symptoms are there because maternal antibodies are present and they provide immunity. But what happens afterward, the child is susceptible to bacterial infection, mainly because of this immunity or humoral immunity is very important. Okay, so that is other immune deficiency disease. Next one, that is chronic lymphatic leukemia. Here what happens, there is uncontrolled proliferation of leukemia, that is proliferation, large amount of cells are produced, proliferation of lymphatic series, T lymphocytes mainly, or lymphocytes you can say, but this are telegram Anand, please give telegram channel link. uh, uh, I think I'll share you. I don't have much idea. You can get from this Unacademy website. You can get the telegram channel link, telegram channel link. Okay. Sorry, but I don't have the link at present, and this live chat will disappear as the session ends. So, if possible, be present in tomorrow's class. I'll just copy the link and I'll paste it. Okay. By tomorrow. Give me a day. Okay. Anand. Okay. I don't have at present and I cannot switch over. Okay. Okay. Thanks. So here you can see. So there is uncontrolled proliferation of lymphocytes. Okay. But these lymphocytes produced in large amount, but they are immature. Because of this immature lymphocytes, immunity is affected. So there is immune deficiency. Second cause for immune deficiency, another cause, fourth one, that is acute lymphatic leukemia. Here, uncontrolled production of mainly T lymphocytes. You can see in acute cases, T lymphocytes proliferate. You can see here CLL, chronic lymphatic leukemia affects B cells. Okay? Both of their uncontrolled production is there, but they are immature, so they cannot perform their functions. Okay. Next is malignant myeloma. In malignant myeloma, what happens? There is proliferation of clones of plasma cells, but they are proliferated, but their functions are affected because of this uncontrolled production. Okay? Now, next immunodeficiency disorder, that is AIDS, full form, that is acquired immunodeficiency syndrome. You may have the question like, write down immune abnormality related with the immune system. When the question is like this, abnormality associated with immune system, you have to write down autoimmunity. If your question, we will discuss also with question autoimmunity. Then you can write down this immune deficiency, immunological tolerance also you can write down when it is a deficient, then autoimmunity. And this immune deficiency, you can write down this all, AIDS and chronic lymphatic leukemia and acute and all. Okay. DGOT syndrome, hypogammaglobulinemia, and last one, that is hypersensitivity. So these are all abnormalities related with immunity. Okay, so this is the question asked in university exam. Am I audible? Okay. So AIDS, acquired immunodeficiency syndrome, that is caused by HIV, human immunodeficiency virus. Okay. Here in human immunodeficiency virus, what happens? This virus is RNA retrovirus family. Okay. So here this virus has got, you can see, glycoproteins present on the surface of the virus. Here you can see. Okay. This glycoprotein, this surface receptors, these receptors, they bind with which target cells mainly? They bind with lymphocytes. You can remember this names of this cells: lymphocytes, monocytes, macrophages, and dendritic cells. All these are important for immunity. You can see macrophages and dendritic cells, these two are antigen presenting cells. Okay. And other lymphocytes, they are important for immunity. So all these immune cells are destroyed by HIV, human immunodeficiency virus. Okay, now how it works, mechanism of action, you can see here. First of all, you can see this virus enters in the host cell. So these are receptors, and now virus enters inside the host cell. Okay. Now, there is activation of the enzyme. Name of the enzyme, that is reverse transcriptase. Reverse transcriptase. Okay. So it causes reverse transcription, you can see here. And this viral RNA, that is converted into DNA with the help of host DNA. It uses DNA of the host. Okay. And it increase in the number, it replicates, you can see here. Now DNA is formed, now it is replicated, then it ruptures the cell, host cell, and it comes out, and then now it infects next cell. So this is the way how it affects the cell. Okay. Next is transmission of the infection. This infection is transmitted, I think we all are aware about the transmission of HIV, that is sexual intercourse with the, because the secretions, they contain the virus, sexual intercourse with infected person through contaminated needles, and vertical route from mother to child. Okay? So these are all the ways. And how can it be detected? It is detected by ELISA test. Here, what we are detecting is, we are detecting presence of antibodies against the virus. I'm not going in detail of ELISA, otherwise it is another topic. Clinical features: because of immune deficiency, chances of infection increases. Like the person is having infection in the lungs in the form of pneumonia. The person is having GI infection that may produce nausea, vomiting, diarrhea, and weight loss, significant weight loss. Brain infection produces meningitis, encephalitis, and abscess also may be there. Then some neurological functions are also deteriorated. Neurological functions deteriorated. Okay. Sometimes this virus grows in the lymph nodes. So lymph node enlargement, that is known as lymphadenopathy. Lymphadenopathy. Okay. And increased chances of malignancy, because this malignant cells, as we have discussed, they are destroyed by by immune mechanism. How to prevent? That is by safety measures. One can educate the public, education first of all, that how it spreads, education to HIV infected individual, okay, education to IV drug users, education to medical related nurses and all, pregnant mother tested for HIV, okay, and safer sex techniques and use of barrier contraceptive. Okay, so these are all the method to prevent. So this is about immune deficiency. Next topic, that is hypersensitivity. This is also one of the important topic. So hypersensitivity means exaggerated immune response, increased immune response to the allergen. Here the word is allergen, more specific than antigen. Okay? So allergen may be food substance, like somebody is having allergy of peanuts, or somebody is having allergy of citrus fruits. So that is allergen. Inhalant, sometimes dust, pollutants, they also may produce this allergic symptoms. Contactants, some metals also produce hypersensitivity reaction. Drugs, common drug is penicillin, produce hypersensitivity reaction. And sometimes infectious agents like virus or bacteria, they also produce hypersensitivity reaction. Okay. Harsh Kolpete. Hi, hello. Now, this hypersensitivity is divided in 4 types. Okay, type 1, 2, 3, and 4. These divisions are depending on which part of the immune system is involved. Okay, there are different parts we will discuss. One, that is anaphylactic hypersensitivity. We will discuss one by one. Just let me enumerate first. One is anaphylactic hypersensitivity. Second, that is cytotoxic hypersensitivity. Third one, that is immune complex mediated hypersensitivity. And fourth one, that is delayed type of hypersensitivity. Now, starting with first one, that is type 1 or anaphylactic hypersensitivity. Here, what happens? You can see here, this is mast cell. On the surface of mast cell, we have IgE, immunoglobulin E. Okay? This is also known as reagin. Reagin, it is written. When antigen, particularly this is not antigen, this is most of the time allergen. So whenever there is allergen or antigen reagin complex, when this allergen binds with this antibody, what happens? This binding results in increase permeability of the mast cell. So what happens? From mast cell, substances are released. So what are the substances which are released? They are histamine, heparin. Then you can write down all this also. Slow reacting substance of anaphylaxis, platelet activating factor, and chemotactic substance. All these are released and they are responsible for this hypersensitivity reaction. What is it? What they cause is they cause constriction of smooth muscle, mainly smooth muscles of bronchi. Smooth muscles of bronchi are constricted. Okay? So that causes bronchoconstriction. The person is having difficulty in breathing. And second thing is there is vasodilatation. Blood vessels are dilated. And what happens when blood vessels are dilated? There is shock because volume is 5 liter and capacity of the blood vessel becomes 7 liters. So what happens? Blood pressure falls. The person is having severe fall in blood pressure that results in circulatory shock. Okay, so this is type 1. Now, what are the symptoms here? One, that is anaphylaxis. Anaphylaxis, you can say, that is severe form of hypersensitivity reaction. Severe form of hypersensitivity reaction. This occurs commonly after sensitivity reaction. Okay. Commonly this occurs when we are injecting the allergen because directly it reacts with our basophils and mast cells. And commonly this is seen with the drug penicillin. Penicillin is the common drug for this hypersensitivity reaction. Okay? So here this drug may cause death of the individual. So always before giving penicillin, always we used to give test dose. Hmm? Test dose means small amount of penicillin that is given on the forearm. Hmm? Forearm. Okay? Slightly subcutaneously. And then watch for the reaction. If there is no reaction, then only it is injected. And every time when you are injecting, you must have to check this reaction. Okay. So here what happens? Suppose we have injected without testing on the forearm. Then what happens? Because now it is in circulation. So there is widespread allergic reaction. Okay. So what happens here? Widespread means all body blood vessels are dilated, vasodilatation. And second thing is increased capillary permeability. So fluid comes out. So sudden fall in blood pressure. Okay. Circulatory shock and the person may die also, death. Okay. Then second thing may occur here is leukotrienes are released, that is slow reacting substance of anaphylaxis. And it causes bronchospasm or bronchi are constricted. So it is like somebody is choking or just compressing our bronchi. Person cannot be able to breathe. So that produces attack or like asthma like attack. And because of suffocation also the patient may die. So this is one of the severe form of hypersensitivity reaction. You can see here, this is the anaphylactic reaction. You can see allergen or antigen. Then antibodies are produced. So first exposure, what happens? These antibodies are produced. Now on second exposure with the same allergen, now this binds with the IgE as I told you. Okay. And there is increased permeability, release of the substances we have discussed. Okay. Now, next symptom of hypersensitivity is urticaria. Urticaria, here what happens? This antigen enters in the skin areas, and here when histamine is released, it causes vasodilatation. Because of vasodilatation, you can say there is redness. and permeability increases, that produces swelling. So this is shown in the form of urticaria. Okay. Next one is hay fever. Here what happens, this antigen and antibody, sorry, allergen reagent. Here we will not name this as antigen antibody. Here allergen and reagent. Allergen is the antigen and reagent, that is IgE. So allergen reagent reaction, it occurs in the nose. And here in the nose there is release of histamine. Okay? And this histamine causes vasodilatation and increase capillary permeability. So we have running nose. No? So secretion increases. Secretion increases and there is swelling. Increase swelling. Irritation also sometimes may be there. Sneezing. These all are the symptoms. हम लोग कहते हैं ना एलर्जी होती है तो दिस आर इरिटेशन स्नीजिंग सो दैट इज बिकॉज ऑफ दिस मैकेनिज्म then asthma, here again same thing, but the reaction, allergen reagent reaction takes place in the bronchioles. You can see here this is normal airways, this is asthmatic airway, and this is during attack, so small opening, so the person is having difficulty in breathing. And here the substance which produces this asthmatic attack, that is SRSA, slow reacting substance of anaphylaxis. Okay, the person is having difficulty in breathing. So this is about type 1 hypersensitivity, which we have discussed. Anaphylactic hyposensitivity. Next is cytotoxic hypersensitivity. Here what happens, cytotoxic, name itself suggests, cyto means cell, toxic means destruction. So what happens, antigen antibody reaction takes place on the surface of the cell. Suppose here this is the cell. We have discussed with the this hemolytic disease. Antigens are present on the RBC membrane and antibody binds with it, and that causes destruction. So here you can see same thing is there. Antigen antibody reaction on the surface of cell. Cell gets destroyed by phagocytosis and lytic enzymes. And here antibodies used in type 1, antibodies were IgE. Here antibodies are IgG for Rh incompatibility and IgM for ABO incompatibility. So here what happens, because of Rh incompatibility, the person is having hemolytic disease of newborn. And because of ABO incompatibility, the person is having transfusion reactions. So this is cytotoxic hypersensitivity. Third variety, that is immune complex mediated hypersensitivity. Here what happens, you can see in the diagram. Antigen antibody complexes are formed, this one. And these complexes, they are, antibodies are IgG and IgM, as well as sometimes neutrophils, eosinophils, lysosomal enzymes, they also act as antibodies. And they are deposited in various organs, like you can see kidneys, in the joints, sometimes in the eyes, skin, and they produce symptoms like, when they are deposited in the kidney, they produce glomerulonephritis. If they are in the joint, they produce joint pain. And in the skin, they produce rashes. So these are the symptoms. Okay? Then next is type 4, delayed type of hypersensitivity. Here, important difference is type 1, type 2 and type 3, antibodies are produced. So that is by B lymphocyte. Here this is by T lymphocyte. And because, why is it delayed type? Because antigen is detected by T lymphocytes, then clone of the T lymphocyte gets expanded, more T lymphocytes are produced, cytotoxic cells, and they cause destruction. Example of delayed type of hypersensitivity reaction, that is contact dermatitis. Because of contact, there is inflammation and this immune reactions. And graft rejection, these are the examples of delayed type of hypersensitivity. Last small topic, that is immune modulation. Here what happens, our immunological response is modified, that is either enhanced or reduced. Enhanced, why? Because the response is enhanced, because if we have some factors that modulate our immunity in the upper side, like suppose we are taking good food, we are doing pranayam, we are doing exercise and all, so they modulate it upsides. And if some other factors like stress, like food, which may increase the chances of infection and all, so they suppress our immunity. So this is immune modulation, and these all are known as adjuvants. We have natural immunity, but that is adjuvant, means that is enhanced or reduced. SH, there is live chat. When will this crash course get complete? Most probably, this course will be completed by the end of December or January 1st or 2nd week. Okay? Do you have your exams? SH? If you are available, please answer. Now, questions from today's topic. You can write down. Describe physiological defense mechanism, innate immunity. Okay. Today's topic, we have this question, this one. Other questions we have discussed. Okay. Discuss how immunities are initiated. Discuss the types and abnormal conditions related to immunity. Okay. So this is the question from today's class. Okay? Short notes also we have already discussed. Okay? Thank you all. If you like my video, press the like button, and you can share with your friends, family, and other juniors. Okay? Thank you.